Urban Heat, 98.1 FM and 1410 AM.
The views, thoughts, and opinions expressed on this show are those of the host, guests, and callers and are not necessarily those of WZBR, its management, affiliates, and advertisers. WZBR and the Urban Heat holds no responsibility for the validity and or accuracy of information on this show.
Hi, I'm drkerryann, and I understand the importance of Black mental health. That's why I decided to start my own show on the Urban Heat, Black Mental Health Matters. Join me on Sundays at 1 p.m., where we will discuss interesting topics and meet experts in Black mental health. Let's talk about the mental health issues facing our community. Listen online at heat981fm.com or download the app 98.1 FM, the Urban Heat. See you then.
Hello, 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 and welcome back to Black Mental Health Matters. I'm Dr. Carrie-Ann Williams, and I'm a psychiatrist here in Massachusetts. And this is a show about everything related to mental health in the Black community. So you can call in at any time. The number is 617-238-7111. We're also streaming live on Facebook on 98.1 FM, the Urban Heat. And you can add me on Instagram and Facebook at Dr. Carrie-Ann. So welcome to the show. It's a beautiful day today. It's Labor Day weekend. And hope you guys are trying to find a way to do something fun. But we're also still in the middle of a pandemic. So I wanted to ask, how are you guys doing? How are you doing? We're still operating with restricted movements. And I don't know about you, but after being in this pandemic for so many months, it's kind of starting to wear me down a little bit. So today I wanted to talk about where are we now? Where are we now with COVID-19 and our mental health? On March 11, 2020, the World Health Organization officially announced that we were in a worldwide pandemic. And throughout this pandemic, there's been ups and downs, from complete lockdown at the very beginning to this gradual reopening, and then the summer months where people maybe started to venture out a little bit, primarily to outdoor spaces. And now we're going into the fall. And as we go into the fall, parents are thinking about plans for school. Are they going to be homeschooling? Are they going to be sending kids back out to school? Is it going to be a hybrid model where their kids are in person some days and online other days? There's all these kinds of thoughts and plans and anxieties about school for the fall. And also, some of us are thinking about flu season. So I'd recommend that you get your flu shot early, guys, because I think there's going to be a much higher demand for the flu shot this year. But our anxiety has gone up, and then it's gone down a little bit, and I think it's starting to rise up a little bit more. And now there is, of course, the other part of the COVID-19 saga. There's the medical part, but then there's also the fatigue of just being in this pandemic for a long time, and dare I say a little sadness even, because our ability to interact with people the way we normally do has been affected. So even just something as simple as being able to hug somebody, we're having to do the elbow bump situation, which doesn't really substitute for a hug. And we're just not able to socialize the same way. Even if we start to feel a bit stressed, we don't have all of our usual options for how to unwind from stress or get a real break from work. If you used to separate work from home and now you're working at home, you can't really separate those two things, and it's sometimes more challenging to get that real break from work. And there's actually some sources that are saying that there's going to be a mental health pandemic after, or because of COVID. And that this time in history is going to carry a shadow with it, where a lot of people are going to be feeling the emotional effects for some time. What do you guys think about that? Do you think that there is going to be a shadow, like a second wave, where there are emotional effects kind of following the COVID-19 pandemic? Drop me a comment on Facebook if you feel like that's actually true. Now, on the other hand, some people are thriving. There are some people that have the kinds of businesses that are maybe relatively unaffected by the pandemic. Maybe their business doesn't require a lot of close personal interaction, and so social distancing doesn't affect it very much. Maybe their business is primarily online, and so they can still ship items. Maybe they can make masks or deliver food items, and so they're still able to kind of make ends meet. And then some people like myself, I actually have more work than usual because if I can work from home, I don't have a drive time. So then I can schedule all the meetings back to back and have a lot more kind of crammed into a day than I normally would have. So for folks like me, you may actually be working more than usual. And no matter what your situation is, whether you're working more than usual, whether you're thriving, surviving, or struggling, I think it's time to check in. It's just that time to check in about how things are going. How is COVID-19 treating you? You can call in at 617-238-7111 or drop me a comment on the Facebook live stream for 98.1 FM, The Urban Heat. I'm Dr. Carryann Williams, a psychiatrist in Massachusetts, and you're listening to Black Mental Health Matters. And today we're doing our check-in, COVID-19 and Black mental health. Where are we now? So, why is this even important? Why is it even important for us to talk about COVID-19 and Black mental health? Well, as you guys know, systemic racism has led to well-established disparities in the healthcare system. A global pandemic like COVID-19, on top of the already present system of racism, kind of perpetuates the issue. And because of systemic racism, we know that our communities have different access to healthcare. We know this. There's different accesses to, there's a differences in access to transportation for us. There could be some differences in availability of childcare. There are differences in the ability to take time off from work. And that's on top of the already present issues of implicit bias by healthcare workers and sometimes even support staff in clinics who treat Black patients differently. I know for myself, even from the moment I walk into the lobby of a healthcare facility, before someone knows that I'm a physician, I might be treated one way just for being an average Black person walking in. And when a person finds out that I am a physician, sometimes I'm treated differently, and that shouldn't happen, but it does. So there's definitely disparities that I've seen as well, just being a patient in the healthcare system. We in the Black community are also more likely to be essential workers. So that could be healthcare, or it could be grocery stores, pharmacies, public transit, like buses and trains. And in some of these positions, there is kind of a necessary close contact with the public. So sometimes you really can't do social distancing. You have to interact with people. So you have a higher risk, but you may have no paid sick days. And some of you listen to Larry's show after mine. It's a great show. You should listen to it. Larry has always talked about how there's a definite wealth gap in Black America. And what that means is that some of us actually can't afford to miss any work days. So if you get sick and you have to quarantine for 14 days and you don't have paid sick days, you're quarantining for half the month without pay. If you have no financial margin, that's a really big problem. And then the other systemic factor is housing. So many of us live in spaces where we live with multiple generations, or we may live in buildings where there are a lot of other families. And if conditions are somewhat crowded in terms of your interaction with people, you have a higher risk of being infected, or you may at least have anxiety about your risk of being infected. And so all of these things kind of come together and make it important for us to realize that COVID-19 and the mental health effects of COVID-19 is of particular importance to us in the community. And so how can you know if COVID-19 is affecting you emotionally? You know, a lot of us kind of are pretty resilient. We try to push through things. We're trying not to think too much about how we feel about things. But there might be other signs that we may be feeling a little bit or being a little bit affected by this. But I want to tell you first about a recent CDC study that kind of emphasized to me why it's important for us in the Black community to not stop talking about mental health and the COVID-19 pandemic. So this summer, a CDC study said that 40% of US adults reported struggling with some emotional effects of the pandemic, most often depression and anxiety, or reaching for substances to self-medicate. And in the survey that was done, a surprising 11% said that they had seriously considered suicide during the time of the pandemic. And of that 11%, 15% of those people identified as Black. And if you know how many people identify as Black in the general population, you'll know that 15% is an overrepresentation in this group. So of the 11%, 50% of them identified as Black that had said they were seriously contemplating suicide during the time of the pandemic. Guys, our community is feeling the impact of this, and it's really not to be ignored. So here are some things that I want you to think about, to ask yourself, to say, well, maybe I'm pushing through this and surviving, but is this getting to me? Are there some problems? The first thing I want to ask you is, how are you sleeping? How are you sleeping? Now, when the pandemic lockdown first happened, everything was kind of upside down. You know, we expected a lot of things to be different. But now that we've kind of shifted from the acute phase into the more chronic kind of stages of things, is your sleep still affected? Are you still having problems sleeping? Are you sleeping too much? Are you sleeping too little? Are you sleeping the same amount except your sleep quality is actually very poor? If you're still having problems with sleep, that is one of the number one signs that your body might be under stress. How are you eating? What's your appetite like? Again, at the beginning of the pandemic, particularly if you had to be at home, maybe work from home, or you're just, you know, there was a lockdown, so we were at home a lot. A lot of people were snacking a lot more and grazing, and it was just because of the difference in routine. But now, months later, is your eating pattern still off? Are you eating more than usual? Are you eating less than usual? Or do you have a lower appetite? Do you find yourself still reaching for a lot of unhealthy or junky kinds of food? Because that might mean that your body's under stress. One of the first things that's affected when our body's under stress is our GI system. So we tend to have stomach tightness, stomach ache, sometimes nausea and loss of appetite. But for other people, they may actually, when they're anxious, they eat more. So that may be a sign your body's under stress. Do you have a medical condition that has worsened? So maybe you had something that was under good control. Maybe your asthma was under good control, your blood pressure was under good control, your diabetes was under good control. And now, you know, when the pandemic started, it started to kind of maybe flare up, but it's still not under good control. It's still taking some time to kind of go back to where it was. Those are signs your body might be under stress. Even mental health, if you had depression that was under good control and now it's kind of been exacerbated, that may be because of the effects of the pandemic. And it's not necessarily something that you're doing wrong. It's just been a long time that the world has changed. Are you drinking more than usual or reaching for drugs? So let's say prior to the pandemic, you maybe had a glass of wine with dinner, but now you're having 2 or 3 glasses. That could be a sign that you are trying to cope using alcohol. And let me just tell you that it doesn't work. It doesn't work. Alcohol is a false solution. It's a false friend. It's something that masquerades as a solution, but it isn't. It isn't a solution. And so that might be a sign, if you find that you're drinking more or reaching for drugs to self-medicate, that maybe at that point you maybe need to talk to somebody. Maybe you look into telehealth therapy services. If you want me to post some links for how to find a therapist, I can do that on my page. Just drop me a comment on Facebook and let me know you want me to post some links for how to find a therapist. Are you more irritable than usual? Is everybody in your family kind of snapping at each other? Like, are you snapping at your kids? Your kids are snapping at you. That irritability could actually be a sign that everybody's under stress, particularly if that doesn't usually happen in your house, or if you're usually a pretty laid back person. Irritability can be a sign that this pandemic is kind of wearing on you. So guys, there's a lot of different kind of mental health screenings that are available online on the Mental Health America website, And if you want me to post that to my page after the show, just let me know. Just drop me a comment on Facebook. Let me know if you want me to post the link for those mental health screenings to Mental Health America. And have you guys noticed any of these signs in you or in your family? Like the changes in sleep and appetite and even just the irritability? Are you noticing that happening for you with this pandemic? Let me know. Give me a call at 617-238-7111. We're streaming live on Facebook on 98.1 FM, The Urban Heat. I'm Dr. Carryann Williams, and you're listening to Black Mental Health Matters. And today we're talking about COVID-19 and Black mental health. Where are we now? Now, some of you may have had the COVID-19 infection and recovered. You already did your quarantine time. You've tested negative, all that good stuff. You've recovered. You may also have some emotional effects just from having that experience as well. Because having had the infection can lead to some things. For one, sometimes even after you've recovered, people still behave differently around you. They may act in an anxious way. They may still be afraid that somehow you're still contagious. And that can be frustrating. It can lead to feelings of isolation. You think, what can you really do to kind of deal with this? And some people can even worry that they're going to be reinfected. And I'll tell you that some of the latest science shows, because I know earlier on in the pandemic, there was all this kind of unknowns about what it means to have the virus and recover. And increasingly, science is actually showing us that if you have the virus and you recover from it, your immune system will develop a memory for the virus, so that if you come into contact with it again in the future, your immune system will remember how to fight it off, similar to how a vaccine would work. That's how a vaccine works. The vaccine gives your body memory for an infection, so that if you then come into contact with that virus, your body knows how to fight it off very quickly. So if you recover from COVID-19, you will develop that immune system memory, is what the science is telling us. Now, sometimes even having had gone through the infection, depending on what that was like for you, you may have had to go to the ER. You may have had to be hospitalized. And that experience of having it be severe or having to be hospitalized, that can cause some trauma. Now, remember that we've always said that in our community, in the Black community, we already have a lot of trauma. There's racial trauma, there's trauma from systemic issues. So then if you add on top of that medical related trauma, that kind of puts us particularly at risk, right? And then for some of us, kind of like myself, that likes to feel productive and industrious, if you had to quarantine and not be present at work, you may have feelings of guilt that you're not there in person to do the work. So there's a lot of kind of things to think about of why it's important for us to keep talking about this, why it's important for us to kind of check in. And so one of our Facebook listeners says that she's had family members that had COVID-19 already. And yeah, and this is the thing, is if you had COVID-19 already and you've recovered, there's a lot of things you can do. The science shows that after about 14 days, there was a quarantine period, your chances of being contagious or spreading the virus dramatically decrease, because by about 10 to 14 days, you will start to develop neutralizing antibodies. It's something to kind of think about. If you've had family members that have had COVID-19 in the past, if they've recovered, then you continue to follow what we call universal precautions of washing your hands and still do the social distancing, but don't be so worried, about, what's going to happen with them if they've recovered. Just follow what your doctor says, your primary care doctor. They're going to be able to tell you the latest on what they're hearing and what your risks are. So what I wanted to do is talk a little bit about how you can manage some of this stress. as I said, there's a lot of stress to go around. There's the stress of having the infection. There's the stress of worrying about whether or not you're going to get the infection. And for a lot of parents, they're worried about their kids, right? Our Facebook listener also said that, they're worried about a second wave because their child is going to be going back to school, is kind of doing a hybrid schedule where they're kind of on and off. And so they want to make sure that their daughter is okay. And so there's a lot of stress to go around. Any one of us can become overwhelmed. So I want to know from you guys, what are you doing to stay emotionally healthy during this pandemic? I mean, we've had several months. Some of you may have tried strategies that have worked for you. Give me a call at 617-238-7111 or drop me a comment on Facebook. Let me know what you've already tried. But one of the things that I would suggest, if you haven't done it already, because again, when things just kind of are acute, when things just start, sometimes it can make us scramble. Now's the time to really kind of think about what you want to do that will have a longer effect on your stress level. The first thing that you can do is to lean deeper into your spiritual faith. So lean deeper into your spiritual faith. For those of you who have a spiritual belief, things like this can really throw us for a loop, and we think, well, how can this happen? It can cause us to question our faith or to question God. But if you have a spiritual belief like I do, now is the time actually to lean in deeper and ask the questions of your spiritual leaders, and to read and to pray and to kind of meditate and ponder. It's time to just find that inner place of calm and to rebalance yourself. The other thing that I would recommend as a psychiatrist, and this is something that I do with my clients as well, is I would encourage you to explore your thoughts. Explore your thoughts. Think about what you are thinking about. So what kinds of things are you saying to yourself? What's your self-talk? What kinds of images pop into your mind when you think about the pandemic? I want you to just kind of reflect on that. What kinds of things pop into your mind when you think about the pandemic? Do your thoughts tend to be catastrophic? That you think, oh my gosh, things are going to get worse? Do your thoughts tend to be optimistic? You think, oh, we're going to find a way out of this. And when you have these thoughts, when you think about these things, how does it make you feel? What are the emotions that you experience? Do you feel more anxious, or do you feel more reassured? You want to lean towards the thoughts that are more likely to make you feel reassured rather than anxious. So examine that, explore that, and think about what you're thinking about. And then the next layer is, what do your thoughts lead you to do? So when you have these thoughts and they make you feel a certain way, what does it lead you to do? So are your decisions based on fear, or are they based on information, scientific data? If your decisions are based on fear, you need to shift more to making sure you have the information you need to make your decisions based on data. So we know that scientific data tells us to wear masks, try to social distance, wash your hands all the time, try to kind of limit the number of places you go to limit your risk of exposure. Follow the data rather than making decisions based on fear. So after having explored all your thoughts, I want you to think to yourself, is there a specific thought that is feeding into your anxiety? Is there a specific thought that's feeding into your anxiety? Because once you identify that thought, then you can actually do something about it, right? And for more information on exploring thoughts, there's a great webinar on the Harvard Medical School website. If you want me to post that webinar, just let me know, drop me a comment, let me know if you want me to post that webinar. One of our Facebook listeners says that to cope during the pandemic, they've started reading more books and also learning more about the benefits of mindfulness and the power of positivity. Have you guys out there also been doing the same thing, reading more books and just kind of trying to get in touch with that mindfulness and staying positive? Mother listener says that to cope, that she listens to music and she also reads books and prays a lot, and that she's very spiritual. As I said, I think that is one of the, for me, because I also have a spiritual faith, I feel like it is really, really important to lean into that, to pray. And I feel like reading books is a great time to do that. You can read books through audiobooks or just through regular plain text or ebooks. Is a good time to catch up. And there's a lot of book recommendations out these days. And of course, music really kind of is a regulating thing for our bodies. It kind of hits us in a nonverbal way, but also a verbal way with the lyrics. There's a lot of therapeutic effects to music. And again, mindfulness is something that helps us to really kind of clear our thoughts and to try to be non-judgmental about the decisions that we make and the things that we're thinking. And as I mentioned, trying to stay positive. So as I, and going along with that, my kind of next thought about how to manage stress related to the pandemic is let go of your expectations of normal. Let go of your expectations of normal. Now, some of you have already kind of said, well, yeah, I've kind of already done that. But sometimes the stress that we feel is this longing for things to kind of go back to the state of normal. And I want to say that at this point in time in history, even after the pandemic is over, there are going to be a lot of things that are different. A lot of the way that we work might be different. Some of the ways that we do school might be different. So the idea that we're going to return to a normal, I think, is something that we should let go of. Just be free. Let go of normal, and then look for the positives. Look for the positives, and be optimistic. Look for that silver lining that you can find in the pandemic. So one of the things that I think about as a silver lining is because I'm working from home a lot, I'm saving a lot of money on gas. So I'm doing a lot of virtual meetings. I do go into work maybe twice a week, but I used to go in 5 days a week. So now I'm saving on gas because I'm going in less often. And that for me is a really big silver lining because I used to drive a lot. So I think about those things that I'm grateful for. What are some things that you guys are grateful for during this pandemic? Even though there's a lot of horrible things happening and things happening to people, there's also things to be grateful for. What are some things that you're grateful for? Definitely give me a call, 617-238-7111, or drop me a comment on Facebook. Let me know what you're grateful for. One thing that is always a good way of getting your mind off of problems is to reach out and help someone else. Reach out and help someone else. Have you guys already tried that? It's one of the best ways to get out of a slump. You can even just video call someone you know would enjoy hearing from you. Or sometimes you can donate to like a food charity that you know is going to be feeding people, because you know that with the pandemic, one of the first things that we discovered is that there's a lot of people that would, a lot of kids that got food at school, a lot of people that get food from pantries and different places where they would have to congregate together. And with the social distancing rules, there were a lot of restrictions on how people got meals. And so a lot of people adapted and started doing food deliveries, but they need money, they need donations. And so donating money to a good cause is one way to reach out and get your mind off yourself. But also you can, prepare little care packages. And send it to people. You can prepare a care package and mail it to someone, just something small. And when they get it, they'll just know that someone is thinking about them, that they're not alone. You'll enjoy the process of making the care package. You'll enjoy hearing from them when they receive it. It's just really, really helpful to reach out and help someone else. And it will help to reduce your anxiety. It helps to relieve depression. And it's one way to help us all to get through this pandemic. So those are some things that you can do to kind of get your mind off the anxiety. One other thing that I always would recommend for reducing anxiety is that anxiety tends to kick up when people don't feel prepared, when there's a kind of a lot of unknowns. Hopefully by this time you've done this, but if not, I would say make a plan. Make a plan for what you would do if you did get sick. have it written down. Like, here's a phone number for my primary care doctor. Here is the phone number for the urgent care center where I can have a video appointment and they can tell me what to do next. And that way, rather than, having that uncertainty, which can lead to panic and poor decision making, you will have a plan that just to make yourself feel empowered and less anxious. So plan ahead of time. The other thing is to get your information from reputable sources. I can tell you that getting false information is one of the sure ways to increase your anxiety, because you can get all kinds of really incorrect things on the internet and on social media. So always cross-check everything with reputable sources like the CDC or the WHO. A lot of what they call it fake news, a lot of fake news going around. So, that is something I recommend. The other thing I would say is to take small breaks throughout the day. I think about myself again that, especially if you're busy throughout the day, you're doing a lot of things virtually, you might not even realize that 3 hours have gone by and you've been staring at the laptop the entire time. You've just been so busy checking emails and trying to complete tasks. So for a lot of us, our daily routine has changed, and whatever your situation is, try to figure out a way to take mini breaks. Take mini breaks and make yourself do it. In those breaks, you can just get up, stretch your body, close your eyes, take a few deep breaths, go for a short walk, or even just step outside. Even if you're not going for a walk, just step outside the building, stand in the sunlight for a little bit, and just take a few deep breaths. And I would also tell you, if you have back-to-back virtual meetings, I am officially giving you permission. You can hop off of a meeting a little bit early to give yourself a break. If you have back-to-back meetings, just hop off a little early and say, hey, I'm just going to hop off. I need to do something. And just give yourself a 10-minute break or a 15-minute break even, and go give your eyes a rest from the screen and go do something else. Definitely give yourself many breaks. The other thing is to try to maintain a routine. I think at the very beginning of this pandemic, when everything was in survival mode, we just kind of said, well, we'll excuse everything. Everything is falling apart. So it doesn't matter if you have, a routine, just kind of try to survive. At this point now, we're not in the acute phase, we're in the chronic phase. So it's really important to try to find that new routine. Find the new routine for yourself. So one thing that I do is, even if I'm not going to have a video call that day, I get up and I actually get dressed in my work clothes still. And I get kind of all put together, even if I'm not leaving my house that day or I'm not going to be on a video call. Because what it does is it helps me to stay focused, to stay productive, and to keep my routine. So I would see if you can find something like that for yourself too, where get up, get dressed, keep some kind of routine going. Don't walk around all day in your pajamas at home. It's not going to help. The other thing is, of course, you don't want to pressure yourself to have to be productive every minute, particularly if you're under stress, but don't just be resting all day. That kind of thing can actually exacerbate depression and feelings of loneliness. The other thing you can do to maintain a routine is to try to eat meals at your usual times. As I said at the beginning, people were kind of grazing a lot, eating a lot of snacks, but now you've been in this for a while, so you can start to kind of find some ways to be disciplined and try to have meals at your usual times, and then also try to avoid using alcohol or drugs, which don't work. So have you guys tried the idea of taking online courses? Have any of you been doing that? That's one of the things that people recommend that you can do during this time. It can be a free online course. It can be a paid online course. It can be, something like a fun thing that you just want to learn, like a language or a skill, or it might actually be something related to your work. But either way, if you have the time, you should consider doing kind of expanding your education, which might be something useful that you can use even after the pandemic, or it just may be something fun that you never had the time to do before, and so now you're taking advantage of that time. And there's a lot of those available. You can just search for that. And so I have another one for you may not have thought of. And it's one that I noticed because I work a lot with kids that have extreme stress. And one of the things that I saw that was pretty remarkable at how effective it was, we had both boys and girls. So I'd say this is both for men and women. They would do these kind of like busy work hobbies like crocheting and knitting, and it would actually regulate their anxiety. And so I want to encourage you that crocheting and knitting is not just something for women. Men can do it too. So both men and women, you can consider doing these kinds of busy work hobbies like crocheting and knitting. It actually does reduce stress and anxiety on the body. And it's so regulating. So you may not have heard that recommendation yet on the internet, but that's my recommendation for you, is to consider something like that. If you feel like your body is really tense, or you're feeling that anxious tension on the inside, using a busy work hobby to kind of diffuse that. So have you guys tried any of these strategies over the last few months? Definitely let me know, 617-238-7111, or drop me a comment on Facebook. So that takes me to children. What about children? There's a lot of parents out there that, they don't just have the luxury of focusing on themselves only. They've also got to think about what they're going to do to help their kids during this pandemic. Now, of course, at this point in time in the pandemic, a lot of parents have already tried a lot of things. They've probably felt like they've exhausted all the suggestions and recommendations that they could find on the internet about what they can do with their kids. So you may or may not have heard some of these before, but I think they still are worth saying. So, and as I go through these, let me know if you've tried some of these. Let me know if you have other ideas for what you do with your kids to help them through the pandemic. We're doing our COVID-19 check-in for Black mental health. And the question I'm asking is, what about the children? So one of the oldies but goodies, and it's something that is worth saying again, that will help your children and you, is to play with your children. Play with your children. Now, this will, of course, look different depending on the age. So for a younger child, it's, obviously you might be playing with toys. For an older child, you might be playing basketball. Play can look different depending on the age. One of the ways that your family can kind of do something fun together is to work on a family project together. So it builds community with just that connection and the communication with all of you. And each person is contributing. And it's something that just helps to improve those bonds. I'll tell you guys that playing is like the child's language. It's how their brain develops. And there's so many biological reasons why it's important to play with your children. One thing that's always fun is singing together, like a karaoke thing. Singing together with your kids as a family, or having little dance parties. So you can have that like on a Friday night or something, or you can pick one night a week where that's dance party night, and it gives your kids something to look forward to, and it gives you a break. But definitely help your kids to be optimistic. Help your kids to be focusing on the positives for sure. One thing that you can do as a family is also meditating together as a family. I know a lot of times we meditate individually, but you can also meditate or do yoga together as a family. And again, if you're into that kind of thing, you can do that together as a family, and it can be quite fun. Particularly if you have small kids, so they're trying to do the yoga moves, and it can be, everybody can end up laughing together. Sometimes you can just stretch together. You can do breathing exercises together as a family. Or I've even, seen families doing cardio exercise videos. So you can do an exercise video and everybody's kind of doing that together. You can do that in the mornings. So that's another way that you can help to diffuse the anxious tension, because the exercise is good for your mental health and it's good for your body. But then doing that together with your family will also help to strengthen family bonds. Here's one you may or may not have tried, is coloring together. Color together. So we know that there's children's coloring books, but did you know that there are also adult coloring books? There are also adult coloring books. And you can actually, use a coloring to regulate yourself and have them color with you, and together you're spending time together and you're doing something that works for both of you. One of our listeners says, I 100% agree with playing together with kids help them to cope. Building Legos has worked wonders for her son, and he is an expert in building Legos at this point. And the other thing is also walking outside. So I'll tell you something. I like the idea of the building Legos. There's so many benefits to having kids do things like Legos, besides their enjoyment, because it's really fun. It also builds their kind of, it helps to kind of build what they call the visual spatial skills. So their ability to kind of see things in space and help things fit together. It's something that's kind of like the forerunner for, it's a building block for things like physics and engineering. So it's a really, really useful thing to have kids practice. And when you start young like that, kids get really kind of become an expert at it, and they love it. It's one of the more fun but also secretly educational things that you can get your kids to do, and they can spend hours doing it. So you can buy yourself some time, and it's something you can do with them, or you can have them do by themselves. So it's diverse in that way. But then also walking outside, whether with them, it keeps them busy. It's kind of gives them fresh air and some diffusion of the anxiety. And right, coloring, yes. So and Juliet says coloring, her daughter loves art and draws really, really well. So that's something too, Juliet, is that when kids are good at something, it is really helpful if you kind of promote that. And sometimes what you can do too is, if they like to create things, you can give them little projects to do, have them create it, and then, present it to the family or put it up on the wall or that sort of thing. So it keeps them busy. So yeah. And now, have you guys tried improv acting? I don't know if you guys have tried that. There's improv acting, and you can do improv together as a family. Now, I tend to like acting and drama and things like that. You can find the prompts if you go online and like look it up. You can find different improv games, and that can be fun for all ages. And it usually leads to a lot of laughter. So that's pretty good. And then you can also consider a cooking competition. So, and I know that some people have already tried the kind of like baking cookies with their kids and things like that. And that's helpful too. But a cooking competition is kind of similar to like what you might have on like the Food Network, where you have like the one ingredient and they have to make the ingredient the star of the dish, or you have a handful of ingredients and you're like, hey, what can you make using what we have in the fridge? And it might be a fun way to find creativity in a time of scarcity, because people may not necessarily be going to the grocery store as often as they used to, or that sort of thing. But if you challenge your kids to be creative with the ingredients you have at home, then you can turn a time of scarcity into a time of fun and creativity. And maybe by the end of the week, you can judge all the different dishes and declare a winner. And that could be fun for the family as well. And if you have space in your house, you can consider an indoor picnic. So what about if you don't have time to necessarily do an activity with them because it's Monday through Friday and you're working and you just need them to be busy? So they're being a little bit more lax with the screen time rules these days. The pediatricians are saying, we're allowing kids to have more time with screen time because it's just a unique time in history. So you can go to things like PBS Learning Media. There's free lessons and games. There's the Smithsonian website, has a page, fun stuff for kids and teens. Of course, everybody knows about Duolingo. Duolingo is a free language learning program. And so they can spend a lot of time learning a new language. If they play an instrument, they can practice and they can maybe have a little recital for the family. So they can be practicing that instrument by themselves and then come back together and you can have a recital for the family. And you can even video in other family members and have them do a little recital for them. And you can decide if you want that to happen frequently or if you want that to be a one-time thing. But having them practice something with their musical instrument and then do a recital for their family gives them a safe audience, and it gives them, kind of promotes them working and building on that skill. If you have kids, older kids that maybe have a tablet that has a camera, you can have them do little amateur home videos. And there's like free editing software on some computers. So they can make little home videos, and then maybe at the end of the week or when they finish that project, they can actually present that home video to you guys, and you can watch it and enjoy it together. Keeps them busy, but also they're learning a skill, and you can work on that. And this one is an oldie but a goodie. A lot of you have done this before, but I'm going to say it again. There is the idea of the chore competition. The chore competition. I've heard a lot of people already kind of doing this one. It is where, of course, if you have more than one kid at home, they can compete to clean certain rooms. You can say, okay, whoever cleans their room the neatest, they're going to win a prize. And so they have the kids kind of working at cleaning and doing household chores and tasks. And if they actually fulfill the requirements and they earn something, and it's something that gets them excited about doing household chores, and it helps you out and it helps keep them busy, and the time kind of goes by, and important things that need to be done in the house might actually be completed with their help. And of course, they can listen to stories on audio, like an audiobook, like Audible. Things like that can keep them busy as well. Some of you have already been trying to use technology to help your kids stay connected with relatives. And just like I would recommend for adults with a routine, I also would recommend having a routine for kids. Again, as kids are when they're a bit older, they often will have some bit of routine because they may have some online schooling or some school expectations. But outside of that, routine can be really tricky, even for teenagers who may feel a temptation to sleep in late or to go to bed late because they're not having to do things the way they normally do. So even though your routine doesn't have to be rigid, it is important to not fall into a completely unstructured day, because that can be disorienting for them. And especially for small kids, if things at home are not under control, that increases the feelings that if things are not they're not under control at home, then they're probably not under control out in the world either, because home is a little bit of a microcosm of what the world is like for them. If home is not under control, they often feel like the world isn't under control either. So even just something as simple as regular meal times for your kids and regular bedtimes despite the pandemic, and just some basic daily expectations can help to hold some semblance of a structure, but still leaving some flexibility for the fact that if they're anxious or stressed, maybe some things are going to be different. Of course, we've already said limit exposure to the news. You can tell them what they need to know. One thing that's kind of fun is having a theme of the week. So that's something that kind of is an undercurrent. You can have a theme of the week or maybe a theme of the day. So it might be something like Crazy Hair Day or Superhero Day, and that can give kids something to look forward to and something fun to do throughout the day. So what are some other things that you're doing with your kids? Definitely let me know. The number here is 617-238-7111, and we're streaming live on Facebook on 98.1 FM, The Urban Heat. I'm Dr. Carryann Williams, a psychiatrist in Massachusetts, and you're listening to Black Mental Health Matters. And we're talking about COVID-19 and Black mental health. Where are we now? So here's one thing that I want to talk about in terms of what do you do when kids actually express their anxieties to you? If they come to you and they tell you that they're anxious, my recommendation, it may sound simple, but this is really, really important. Listen to their concerns. Listen to them. Okay? Don't brush them off. I think a lot of times in Black and in Caribbean communities, when kids bring anxieties and concerns, parents just tell them, don't worry about it, and they just kind of brush them off. Well, here's a problem, is that telling a kid not to worry doesn't make them stop worrying. So my recommendation would be, and rather than telling them don't worry, to listen to their concerns. For one, you want to know what it is that they know about the coronavirus. You want to know if they're believing something that's false, that maybe you can correct for them. you want to know what it is that they're worried about. The second thing is that if you brush it off, that can lead them to feel alone with their worries. So here's the thing is they were bringing their worries to you as a parent so that you could listen to them and provide information. When you brush them off, now they're alone with their worries. Okay, so you want to calmly address their fears and use age-appropriate language, keep it simple. And one thing that's really important when you hear their concerns and anxieties is validate that what they're feeling is okay. It's okay to be anxious. So yes, I know a lot of times we'll say, don't be afraid, don't worry. But sometimes you can say, you know what, it's okay. A lot of people are anxious right now. It's okay to be anxious. Your feelings are okay. But here's what we're going to do as a family to stay safe. Here's the plan that we have if anybody were to get sick. So it's okay to be anxious, but guess what? We're prepared. We're prepared. There's something we can do about this. So I understand that you feel anxious, but here's the solution. Here's what we're going to do. And you also want to be a role model for emotional honesty. So sometimes when kids bring their anxieties to you, I know that we want to be the strong person, and that's appropriate, but you don't want to pretend. Like, don't pretend like the pandemic isn't affecting you at all. Because I'll tell you something, as a child psychiatrist, especially because I meet with kids and I listen to kids all day long. So that's my job, is to listen to kids, right? And they often know a lot more than parents think they know. So sometimes parents think they're keeping something a secret from them, or they think that they're doing a good job of looking calm. But the kid comes to me and says, I can tell that my parent is anxious. They think I don't know, but I can read it on their face. I know they're anxious. I know they're sad. They sometimes can really read your emotional presentation in a way that you may not realize. So it's important to not pretend like the pandemic isn't affecting you. You should be a stable emotional resource for your child, but you can still be honest. So you can say something very simple like, I'm anxious too, but here's what we're going to do to get through this together. So again, you're not delving too deep into your feelings. You're not venting. You're not disclosing too much to them, because that will shift the balance and now your child is going to start worrying about you. You just want to keep it simple and just say, hey, I hear you. I'm anxious too, but here's what we're going to do to kind of make things better. So there's that little glimmer of emotional honesty, but then it's quickly followed up with, let's keep it positive. Let's keep it positive. Let's keep going. And then there is, what if kids are anxious about going back to school? And one of our Facebook listeners, Juliet, is saying that she makes sure that her daughter gets back into her routine because she's going into her sophomore year. And that, I think, is super important, because there's so many things that have changed and it can be so disorienting for kids. And so if you can help them get used to a new normal, a new routine, it can help them feel secure. And it can help reduce anxiety. So that's absolutely perfect to try to help your 10th grader to get into a routine going into their sophomore year. School is going to look different. They may have different fears. So if your child, depending on what age they are, if they're expressing anxiety about catching the coronavirus when they go back to school, again, try to stay positive and realistic. You can say, yes, we know it's out there, but you want to remind them of all the safety measures that the school is going to have in place, right? So the school is doing everything they can to keep you safe, but also remind them of the positives, like you're going to get to see your friends again, particularly if they haven't been able to see them in the summer, or they didn't get to see them the second half of the last academic year. They're going to get to see their friends again. You want to coach them again around the proper universal precautions, washing their hands, trying to do the social distancing, which is incredibly hard for children to do. So hard to get kids to be socially distant. But you want to, coach them on doing as best as they can. And if they feel nervous about wearing a mask, remind them that everyone is going to be expected to wear the mask, and that it's going to keep everybody safe and it's going to reduce their risk. And So these are some of the things that you can do, and kind of thinking about listening to your child's concerns. Or Facebook listener Juliet says that she has some of the stresses of the pandemic at home, but she does try to maintain herself for her daughter. They talk about things, and yeah, to keep it simple. No reason to kind of like totally vent or delve on the negative. Just keep it simple. You just try to stay positive. You know, her daughter tells her how she's feeling, and that, you know, and Juliet's there to support her as best as she can as a mother. And that's the best that you can do as a parent, right? Because you're taking care of yourself, you're taking care of them, and you're just trying to make sure that you're doing the best you can to stay safe and to reduce anxiety and to make it through the pandemic. As I said, guys, for all of us in the Black community, COVID-19 is especially important for us to pay attention to, because we have pre-existing mental health vulnerabilities because of systemic racism. And so we have to be vigilant. We actually have to be intentional about taking care of ourselves. So, you know, I think that as you go along this week, I want you to try to incorporate some of these things. I want you to try to incorporate the taking breaks throughout the day, and kind of taking a breather and doing all these things. And if you want to know any of the links that I had today about ways to kind of check your mental health screenings, then just let me know, and I can kind of pop them into the Facebook feed throughout the week. And I want you to join me again next week for Black Mental Health Matters. And next week, we're going to have a group from Parenting Journey talking about what they're doing to support the Black mental health of parents that come in through their organization. So I want you to join me for that. I'm here every Sunday at 1 p.m. on 98.1 FM, The Urban Heat.